Well, thank you for joining us for another Learning with National Leaders presented by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. I'm Carol Daniel, your host. We chose to center tonight's discussion around survivorship with a special session featuring patients from Siteman Cancer Center. 3 survivors, Sarah Draper, Jay Turley, and Sarah Anderson. We'll also be focusing on Siteman's Survivorship Clinic, the additional outreach programs they offer, as well as the role of genetic testing with cancer survivors and what it means for the rest of their families. Before we introduce our Siteman panelists, and of course we always have a great panel for you, we want to give you a unique perspective and hear from cancer survivors themselves. Earlier this afternoon, we sat down with cancer survivors to record this video to help us get a better understanding of each of their journeys. So let's meet our round table of patients. They are cancer survivors. We are cancer fighters is who we are. So let's meet Sarah Draper, who is a breast cancer survivor. Sarah, thank you.
Hi.
Jay Turley, a patient, a prostate cancer fighter. We have established that. And Sarah Anderson, who survived cancer as a child. So we want to get right into our questions. And Jay and Sarah, I want to start with you of how the cancer diagnosis impacted you and your family. Jay, can you start?
Yes. Scared, fear, anger. You know, the fear of the unknown, the anger to, you know, why me, why him, you know, the fear to, you know, what's next, you know, are you gonna live, are you dying, you know, what's that going to be, when that's going to be, you know, it was just all those things, and you know, it was just sadness and anger.
Sarah, they tell you you have breast cancer, you hear it, then you have to tell your family.
Right. I told my boyfriend, whom I live with, and he's been with me every step of the way. We raised my nephew. I didn't tell him for a few weeks because he was getting ready to graduate 8th grade, and so that was stressful. I will say having cancer has impacted every part of my life. Physically right now, I've gained weight from the medication. I'm tired a lot. You know, that comes with like a change of body image, a lot of stress, a lot of emotions going with that. So like your whole body, your whole person, your whole life is impacted when you have cancer.
And Sarah, you were how old?
I was 11 the first time.
So I can only imagine that your parents, they were impacted a great deal.
Yeah.
How did it impact you and your relationship with them?
Yeah. So because I was so young, I had a very tight-knit, like, protective relationship with my parents, and then I was diagnosed again when I was 17, and just like continued to be that overprotectiveness, and it definitely has affected a relationship amongst family and friends, because I mean, the worry of getting cancer once and then getting it again is very scary, but whenever a child gets cancer, it's very scary. So it's definitely affected.
There's an impact with your friendships also,
Yeah.
I would imagine.
Oh, absolutely. It feels weird whenever having that conversation with friends. They don't know how to take it. They don't know. They're wanting to make sure that you're okay. I'm a very delicate person now, I feel.
You're not a delicate person,
No,
but they treat you like a delicate person.
Yes, yeah. And so that kind of changes how perspective and how you have just relationships with people in general.
Jace, everyone at Siteman encourages patients, families to make the resources that are available to use them. And among those resources are support groups. You decided to go to a support group. Not everyone does. Why did you go, and what are you getting out of it?
Well, it's just that encouragement. You know, the encouragement that I get from, you know, fellow survivors that are down further down on the journey than I am.
Because you were diagnosed 7 months ago, correct?
Yes, yeah. So it was a lot of, you know, unknowns for me, and the group was able to answer a lot of those unknowns for me. You know, from the treatments to the side effects to what's next. You know, some of the things to look out for. So I benefited greatly for that. You know, and again, being a safe space and not you know being you know I guess judged, like, you're damaged, you're weak, in that support group, I didn't feel any of those things. I felt safe.
And Sarah, you are in a support group, but it's an art group.
Right, so it's not a current group, but we did an expressive arts group via Zoom about a year ago, and it was awesome. I think creativity is a basic human need, so anytime you can create, you're expressing your feelings, and you have a lot of those when you have cancer, so it really helps to get some of those feelings out, maybe things you can't say verbally, but you can draw a picture, write a poem, and then you're talking about that art and the meaning behind it with the group. So that's really validating, and there's a lot of camaraderie with that. So it was fantastic.
And you do recommend it, I know, right?
Yeah.
Why?
Yeah, absolutely. Well, it's just a validating experience, and I think that it's something that can just help you to feel better and to process everything that you've been through.
So we learn so much from Siteman every time we get together, and one of the things that I have learned is that you are part of the Lifelong Outcome Survivorship Clinic.
Yeah.
What is that, and what's been most helpful about being involved?
It's one of my favorite things, and every survivor that I know, I tell them all about it, that they need to come because it's so wonderful. I go once a year to see Debra Spoljaric, and she connects me with other doctors that I need to see for my late effects that I could possibly have, just to monitor things. It gives me a peace of mind whenever I go, because the world of cancer is very scary, and the unknown of whether it's going to come back is always just that, like, is the other shoe going to drop? And so when I get to go to the Lifelong Outcomes Clinic, it's just like a settled piece that I get to talk with a doctor, and they are monitoring all of the possibilities of what could have gone wrong from the late effects of chemo. And so it's just a good peace of mind to be able to.
And you are learning, we'll say, about the long-term effects.
Yeah.
So that's another reason to go to the Lifelong Outcome Survivorship Clinic. Sarah, I know that you wanted to share a message to other survivors. What is that?
Yeah, I think it's important to be okay with whatever you're feeling. Don't, if you're scared, say you're scared. If you're depressed, it's okay to be depressed. Like, you'll go through those stages of grief and loss, and so will your family, but like, it's okay to feel those feelings, and that's part of being human, and you shouldn't apologize or feel bad for being human. Just sit with those feelings and be okay with that, like, because you're fighting through those, like we talked about.
Jay, I wish we had more time, but I want to hear from you quickly why other, especially men, should go to support groups.
The fellowship, being on the path with other fellows, gentlemen, who are going through the same thing that you are. I would encourage, everyone to do it. Just be brave.
And you are not a cancer survivor. I called you a cancer fighter because you said you don't feel like a survivor yet. I
do not. My journey has just started, 7 months in, and I think I'm still, I haven't reached that finish line yet. So I don't think I've, worthy of that, survivorship at this point.
Sarah, a quick message about being a cancer survivor?
That it's every day that I continue to go on, and I worked really hard to get to this point in my life, and I'm just going to keep going one day at a time.
She worked really hard to get here. Sarah, what about you?
Yeah, I can understand that. Once you've had cancer, like, you've always had cancer. You don't forget about it. It doesn't go away. It impacts how you feel and how you see the world for the rest of your life. So, I think that's why it's really important to be compassionate to other people, and because you really don't know the struggles they're facing on a daily basis.
Jay, Sarah, thank you so much.
Thank you.
Thank you.
We know it helped you. We hope it did. Wasn't that amazing? And I had this serious look on my face the whole time because I was so moved by their stories. Thank you so much to Jay and to Sarah and the Sarahs for sharing their stories. It's a great way to kick off tonight's conversation. Tonight, Washington University geneticist Dr. Amy Sear joins us, as well as exceptional Siteman Cancer Center staff, because they are all exceptional Siteman Cancer Center staff. Survivorship nurse practitioner Dr. Debra Spoljaric joins us. Debra, thank you. And Survivorship Program Manager Rochelle Hobson as well. Rochelle, welcome. Thank you all for coming.
Thank you.
We all did a fist bump. We're ready to get into it. And a reminder, you can submit your questions right here on this website. We're going to try to get answers to your questions throughout the evening, throughout our conversation. So again, get those questions going, get them in. Rochelle, help us get the conversation started tonight. I am a cancer survivor. What does cancer survivorship mean?
I think that's a great place to start the discussion because, as you heard Jay mention, a lot of people don't identify with being a cancer survivor. A lot of people think that unless they've beat the cancer or the cancer's over or they're finished with treatment, that they're not a survivor. And it's not uncommon for people to say, I am not a survivor. And I think what we want to really emphasize is that the National Cancer Institute says that a cancer survivor is anyone diagnosed with cancer. So from the moment you are diagnosed, you are a survivor. And we at Siteman recognize that in our survivorship program. And so survivorship as a whole really focuses on like health and well-being. How do we give you the best quality of life, whether it's right after diagnosis, during treatment, or that time period after treatment?
The minute I was diagnosed with thyroid cancer, I was a survivor.
Yes.
That's an attitude adjustment, is what it is. So who can benefit then from survivorship support? The answer's got to be everyone, perhaps.
I think you're absolutely right. It is everyone, because we know that if an individual has cancer, they aren't the only one who's going through that journey or through that experience. It's the family, it could be the children, it could be a caregiver, our friends, our social network are all part of that. And so anyone who's been impacted or in relationship with someone with cancer can benefit from survivorship.
We heard Sarah talk about being a part of the Siteman Survivorship Clinic. Exactly what is it? Can you tell us a little more about that?
Yeah, so we have 2 clinics through our survivorship program. One of them is specifically for breast cancer survivors, and then we have our lifelong outcomes clinic, which Sarah is a part of, and that is for anyone who was diagnosed with cancer as a child. And so maybe they were 5 and now they're an adult or a young adult, and they then come to our survivorship clinic, which is led by Debra Spoljaric, our nurse practitioner, and they get individualized one-on-one treatment. And I recommend anyone who has been a survivor of a childhood cancer to come to those clinics, because you can get education and resources directly and just a direct line. And then you have that lifelong obligation from us and connection.
And it's important to note at this moment that you do not have to have received your treatment at Siteman, right?
That is correct. If you've had your treatment at another institution, it's not unusual for us to have someone who moves to our area then to come and be seen in our survivorship clinic, because they want to have that continuation of care.
So Debra, I want to bring you in here. Let's talk about the steps of survivorship post-treatment. So they've been diagnosed, they've been treated. Walk us through the steps.
Well, it really depends on the patient and the relationship that they have with their treating physician. So some of the physicians will keep the patients in that survivorship journey in their clinic and keep them and follow them along, and then determine together with the patient that the follow-up plan can be transitioned back to their primary care physician. Other physicians, like breast cancer survivors, sometimes that journey is a little bit longer, and so the physicians will transfer the patients to, like myself, in my breast survivorship clinic, and then I'll keep them for 5, 10, 12 years. It just depends. Every patient's a little bit different. There's not a set standard on what we do. And again, we collaborate with the patient and decide together, this is what I'm recommending, are you ready to go back? And then together we find out what they need during those visits, how the next steps are in their journey, if they're having problems with body image or need some physical therapy or get diagnosed with lymphedema, things like that.
So certainly a patient will see their oncologist. What's the difference in a follow-up visit to oncology versus a visit to the survivorship clinic?
The biggest difference is the focus on the cancer and the cure and the next steps, or if even for patients that aren't cured, then they're focusing on their well-being and how can we help them live the best quality of life for them. So sometimes when they come to the survivorship clinic, our focus is not so much on that cancer and that particular treatment, but also what else can we do to help them live that best quality of life. So whether it's getting back into movement, maybe getting a referral to the Live Strong program at the YMCA, or meeting with our psychologist, because now 3 years post treatment, they're ready to start dealing with the mental fatigue from the treatment and ready to tackle that a little bit now that they're a little bit further out.
And you led me into my next question, and that's about outside resources. There's so many, and you're aware of them, and so you make it your business to connect the patients with those?
Right, we do our best to get the patients the information that they need for whatever they're dealing with at that time.
And all along the way, you're assessing patients' needs.
Right.
And how difficult is that?
It can be challenging.
Yeah, I'd like to piggyback on what Debra said about the resources, because I think that's one of the things that we're really good at in survivorship, is identifying that cancer doesn't just affect a person physically, but there's a mental component, there's a spiritual component, there could be, you know, any number of things that someone is dealing with. And so part of that is our understanding of that, and that is another component of that survivorship clinic visit, is really understanding what other things are going on and then looking at that. I think one that we don't talk about a lot, but that we see a lot, is the financial burden or toxicity that goes along with, now that I've been a primary caregiver, I have cancer, I can't work, I have to take time off. And so again, we're connecting them to resources such as social work, psychology, spiritual care, and those are things that sometimes you don't always get in a traditional visit, but when you come to survivorship, we're able to give that additional support.
It's also encouraging patients to have a conversation with their provider. So just because we tell you that you need to have your heart looked at and you need an ultrasound and you also need your thyroid looked at because I feel something when I'm examining you, and those are all out-of-pocket expenses and your insurance copay is 20%. Well, you need to talk to them and see what's the most important, because if you can't afford it, it's better to do maybe one of the top ones than not any, as well as talk to social work and see if there's any resources. Obviously, we can't fix everything, but it's a conversation.
Right. You won't know unless you ask, unless we talk about it.
Right.
We're going to bring in our Washington University geneticist in just a second, Dr. Sear, but we want to check for some viewer questions. We always have them. Our first one is from Susan, who has stage 4 gallbladder cancer and has had 7 treatments last year. Nothing has worked, and she's in hospice now and is comfortable. What is coming her way? And so that's a broad, deep question.
Yeah, I think when we define survivorship, we do know that survivorship starts at diagnosis, it goes through treatment, and it's after treatment and that time period beyond. So as we make that transition, we change our focus from how do we treat, and we continue though to focus on quality of life. And so how do we make sure that the time that you do have, that you are comfortable, we're managing symptoms, and that we are also giving you that quality.
And the next question is from Lori, a 22-year cancer survivor, now 63 years old. No one really talked about the financial strain long-term survivors experience. We talked about spiritual, physical body image even, and financial.
I mean, I'll tell you, it is true. I mean, back, when 22 years ago, it really wasn't talked. They just wanted to cure you and send you on your way and live happily ever after. And we now know that's not necessarily the case. We want everybody to survive. Obviously, we want to cure cancer if we can. But on top of that, there's long-term effects and treatments. And I'm assuming that Lori's probably referring to that, such as maybe now she has to see the cardiologist, an endocrinologist, and other doctors compared to her friends. And again, that's just extra copays, extra medicines, and it is definitely challenging.
How long is hormone therapy recommended after stage 3A breast cancer?
you want me to take that one?
Dr. Sear, want to take that one?
Sure. In general, most women who have hormone-fed breast cancer will take anti-hormone treatment for 5 years. Women who have a higher risk of cancer coming back will often be on it for 10. And there's testing that can be done to help determine, what the ideal length of therapy is. But someone with more advanced, a higher stage cancer like stage 3 would likely be on it for 10 years.
Our next question, what is known about uterine endometrial carcinosarcoma survivorship? I lost a tooth trying to say that there, but go ahead, somebody.
Our GYN oncology doctors do continue to see their patients in the clinic services, and they have a nurse practitioner that also works with them to address the survivorship needs in their clinic.
So we want to bring in, she already spoke, but let me introduce her officially. Dr. Sear is a Washington University geneticist at Siteman Cancer Center. Dr. Sear, thanks again for being on our panel tonight. Why would someone who already had genetic testing as part of their cancer evaluation and their treatment need to meet with you or another geneticist?
So we now know so much cancer is due to genes, and we've actually figured out how to identify so many of those genes. And I take care primarily of women who've had breast cancer or women who have a family history of breast cancer. So I focus a lot on like the BRCA1 and 2 genes. But even 10, even 5 years ago, genetic testing was very different. And so we used to test just for those 2 genes. So there are a lot of women who had testing years ago, but they weren't tested for any of the other breast cancer genes that we now know about. And so our current standard of care, we would consider their BRCA only testing to be inadequate, not up to our current standard.
So we've talked about the financial part of it and the concerns about the financial part of it. So a person's genetic testing may not be covered by their insurance. What do you say to them?
Things have changed a lot in a good way in terms of the finances of genetic testing as well. So the insurance coverage requirements for genetic testing used to be much stricter. So for breast cancer, for instance, it was a diagnosis at age 45 or under. And genetic testing, when it kind of was getting up and going, was incredibly expensive. And I'll talk to a lot of people who paid $4,000 out of pocket to get genetic testing done because the insurance requirements were so strict. Now we've got 2 benefits. One is that we're doing a lot more genetic testing, and because we've identified more relationships between certain genes and cancer, there are a lot broader indications for doing genetic testing. So insurance companies are covering genetic testing for a lot more patients. So for breast cancer, for instance, anyone diagnosed at age 50 or under, so it's a little bit better in terms of the age range. Anyone with a specific type of breast cancer called triple negative at any age, they're eligible for genetic testing. A lot of women, regardless of their age, are eligible for genetic testing because that information can actually help impact treatment. But in addition to these broader insurance, kind of coverage guidelines, genetic testing has gotten so inexpensive and the technology has changed so much. So instead of taking weeks and weeks to painstakingly do BRCA1 and BRCA2 testing, we're now testing for dozens of cancer genes all at the same time. And even if insurance doesn't cover genetic testing, most of these labs offer a $250 cash price, which is still $250. But pretty much anybody who wants to do genetic testing, even without insurance coverage, can pay $250 and have it done.
And $250 is not $4,000.
Exactly.
Yes. Talk to us about the results of genetic testing and the impact then on long-term follow-up for survivorship.
So if we find a cancer gene that increases the risk of any other cancer, that would definitely change someone's follow-up screening. So for instance, I take care of women who had a history of breast cancer, treated with lumpectomy. They had BRCA testing years ago, which was negative. If we go back, update their genetic testing, and identify, say, a breast cancer gene that they were never tested for, well, based on that breast cancer gene, they may be eligible not only for doing mammograms every year, as they have been, but they might also be eligible for doing breast MRI every year. Sometimes we find genes that have other cancer risks. So for instance, someone who has a history of one cancer might have a gene that also increases their risk of colon cancer or pancreatic cancer. So now they're eligible for more frequent or more intensive screening for those diseases.
I can just hear someone's spouse getting the results of genetic testing over a breast cancer diagnosis and then finding out that you are perhaps you have all these other possibilities. I can't even imagine the effect on the family. What are you experiencing in that regard?
Yeah, that is the one thing about genetic testing that gets complicated, is because you're not just addressing the health of the person in front of you, you're addressing the care for their whole family. And, you know, in terms of, you know, when we identify these genes, then we have to try to identify the other family members that might also have these genes so they can get tested, so they can take advantage of risk-reducing options and increased screening.
And exactly what does Siteman offer?
So we basically, you know, we offer genetic testing and counseling services to patients, whether they have a history of cancer years ago, whether they have a current or a recent diagnosis. We also see a lot of people who haven't had cancer themselves, but say they have a family member in survivorship. And a lot of those patients, even if there's nothing genetic identified, they may be eligible for more intensive cancer screening as well.
Well, we want to go in and see if we have any more questions. And of course we do. From Marcy, Dr. Sear, and Debra, you've been fantastic to have on their care team over the last decade. So thank you very much for that. One thing my spouse voiced was a lack of support for the caregiver. Talk about that.
Yeah, I will tackle that. I think that we hear this a lot. I think we focus so much on our patients and making sure that they have what they need, that we're really bringing more attention now to the fact that, like we said earlier, doesn't just touch the patient. We have caregivers who may be trying to figure out, how do I cook for someone who can't eat or doesn't do that? So we're, you know, always looking at how do we support them. We have our psychology services, one example of a service that could be used for caregivers. They have a caregiver support group. So I think it's always trying to make sure that we put the information out there and everyone knows about the resources that are available to them. But I would agree that sometimes the caregiver gets lost in the shuffle of everything that we're doing to take care of the patient.
I would add that a lot of people don't even think they are a caregiver. I've gone through this conversation regarding dementia and my mother, that I had to be convinced that I was a caregiver. I said, oh, my father is. And she said, no, you are as well. And so we're not, that immediate caregiver is one thing, but the extended family, you are also caregivers. And so that, I can imagine that support. I found the support. I was very aggressive in trying to find support. So thank you so much for that question, because people are often, I think, maybe even embarrassed to say, I'm a caregiver, I need help, because here's my loved one dealing with cancer. Do you find that from caregivers? They don't even want to speak up.
Yeah, well, it's like, who do I have the right to complain with everything that they're going through? And I think one of the nice things with some of the groups that we offer is they are open to caregivers. And so we've had situations in some of our support groups where an individual will come and they will bring their spouse with them to the group, because sometimes just being able to talk through like that together and to know that you are not alone. And I think that's one of the messages that we really want to push today, is that you are not alone and there are resources available to you. And it's, you know, ask questions, ask your primary care team, what are my options? What can I expect? And I think knowing what questions to ask is important.
And asking them.
And asking.
And asking them. So we're going to wrap up here, but Dr. Sear, I want to turn to you again and talk about cancer screening and what a person might need if they've already been treated for or survived one particular cancer.
Well, unfortunately, lightning can strike twice. So just because someone has survived one cancer successfully doesn't mean they're not at risk for other cancers. So for instance, someone who has had a breast cancer diagnosis still needs to do colon cancer screening, for instance. And I would also add, even beyond cancer screening, the beauty, I guess, of cancer care these days is that most people survive cancer. Most people are survivors of cancer. But things like heart disease and diabetes and you know, lung disease, those sorts of things contribute a significant amount of years of life lost. Patients are still at risk for those. So it's really important that we think, you know, it's not just about the cancer. They have this, you know, they need to stay healthy, and you know, we want to try to stave off all those other diseases, catch them and treat them early.
I can say, and certainly our patients who spoke earlier, Sarah, who talked about the way her parents treated her and the way her friends have treated her as if she's fragile. I feel some of that from my husband after thyroid cancer, and not that I'm fragile at all. He doesn't treat me that way, but I think he wants me to change some things because he's worried, right? And so talk to us, Dr. Sear, about the impact of surviving cancer on the family. I see it in my husband.
Yeah, I think, kind of actually as you were talking about, as Rochelle was saying, the family often does get kind of lost in the conversation, especially going through the cancer journey, but they are a big part of encouraging people to, to make healthy choices and, to hopefully, like make it easier for people to get to the gym and to make healthy meals at home, that sort of thing, and really encourage those healthy behaviors.
Yeah, he put a smoothie in my face this morning, is what he did. So it's, I love you. Debra, talk about the differences between childhood cancer survivors and adult survivors. There's clearly a difference, and we heard a little bit of it from Sarah.
Yes, there is. The biggest difference is most centers that have a lifelong outcomes clinic like myself, once patients reach 21, they graduate from St. Louis Children's Hospital to my clinic.
Oh my.
And then my clinic is open to anybody, if they from other hospitals or if they transfer in from different states and were treated as a childhood. I have able and willing and want to see those patients in my clinic, but I don't ever graduate people from my clinic. So we do have a relationship, and if they can get some testing done at their primary care physician, I encourage them to do that and give them the tools that they need. Every patient that walks into my clinic gets a cancer treatment summary and follow-up care plan that details out what their risks are for their late effects. But in addition to that, the guidelines change. So I follow the Children's Oncology Group national guidelines. We're on version 5 of the guidelines currently. Version 6 is due to be released any day now. So it's definitely something that changes over time, and different recommendations for their follow-up from their childhood cancer. Because if you were 4 and now you're 24, 44, the oldest patient I have is 64. So as a survivor twice of cancer, and I just look at them through a different lens than my adult cancer survivors.
I can't imagine a child, we'll go back to Sarah, who was 11 with her first diagnosis, and then you hit 21. You're both excited, I'm 21, I survived, but now it's like you're a whole different person, and what now?
Right, and on top of that, you may not remember what those medications, chemotherapy, radiation, surgery that you had. And a lot of times I had patients tell me, well, Mom always went. I just kind of tuned out. I just kind of didn't listen to what they said, and now they're with me, and even if their parent or significant other does come with them, it's really more about them driving that visit. And so I'm attempting to give them all the information that they need so that if they do move to Florida with their job, that they have the basics of what treatment they had, the name of the chemotherapy drugs, if they had radiation, what was radiated, did they get whole chest radiation all the way down to their belly, or just their sternum got radiated. So, so if I can get that.
They're stepping into ownership now of their own journey.
Right.
So if someone wants more information about survivorship, what should they do?
They can go to the Siteman website and give us a call and get into my clinic to come see us.
Wonderful. It's easy as that.
Yeah.
Rochelle, talk about resources again, if you would, that are available through the Siteman Survivorship Program.
Yeah, so I think what's interesting is like survivorship as a concept, right? We talked about well-being and all the components of it. So in addition to this concept, we realize that everything doesn't sit in a specific program. And so one of our responsibilities is to identify those resources so that if someone is struggling with lymphedema, then we can direct them to physical therapy. So if someone goes to our website on Siteman and then searches survivorship, there's a whole link of resources that are available. So we hear people struggle with chemo brain. We know where we can refer for that. We also have our Siteman Psychology Service, which will see our patients. We collaborate a lot with physical therapy. And I would, to piggyback on what Debra said about how do you get more about survivorship, I think talk to your clinical team. That's going to be important. Ask them what you can expect and what do you need and what types of resources would be available to you. And then certainly reach out. Our information is on our website. our phone number is there, and we're more than happy to try to help direct people to the right resources.
But just the same as that, if you were communicating with your team about your peripheral neuropathy, and that was 10 years ago, things do change a little bit over time. Sometimes new things do come out, or they just have more information to share with you too. So just because you've been dealing with something like hemobrain for 10 years, don't hesitate to bring it back up to the doctors, or go back out to occupational therapy, and get more info and see if there's something else out there that can be identified that's new.
We have another question, but what are the symptoms of chemobrain for those who are listening who think I think I have that, but I don't know?
Just some difficulties, maybe multitasking,
Yeah.
like you're having difficulty, like I never can remember the second thing on my list, the third thing on my list, like that's task oriented, or just
maybe forgetfulness or
there we
foggy,
go. Yeah.
like kind of that foggy feeling. I don't know, doctors, if you have more, but yeah.
No, but yeah, just thinking kind of slowly.
Okay, let's go to this question from David, who was diagnosed with stage 3 colon cancer 3 years ago and was treated and had surgery at Siteman at Barnes. Checkups now are good. Is there a support group specifically for colon cancer?
We do not have a specific group for colon cancer right now, but we do have, through our Siteman Psychology Service, another group. So it is for survivors. So that would be an option, is to go through the Siteman Psychology Service for a list of all the different groups that they have.
Wonderful. Well, that is another wonderful discussion. We thank you so much for joining us, and thank our panelists for taking time to join us tonight. Dr. Amy Sear, Rochelle Hobson, and Debra Spoljaric. Thank you so much, ladies, for joining us. We appreciate it. Great information. Meanwhile, we invite you to visit yourdiseaserisk.com. There you will learn about your risk of 12 cancers and other chronic diseases, and you get to get some personalized tips for preventing them. We also want to mention some exciting news about our new podcast. It is amazing. Season 1 of This is Cancer is available now and streaming wherever you listen to your podcast. And let me tell you, it is raw, it is authentic. They take a look at cancer diagnosis and all of the emotions that come with it. So do check it out. As always, thank you for joining us, and we will see you right here next time.